Hello, my name is Dr. Andre Jones, and here at Inspire Dental, we get a lot of questions about what are dental implants. And so today we're going to take a moment to discuss the most common questions we get regarding dental implants. So one of the most common questions we get asked are, what are dental implants? So a dental implant is a screw that is inserted where a tooth used to be. And when that screw is inserted into the bone, we give it a few months to heal. And once it is fully healed, we can now attach a tooth to that screw. There are many conditions that would cause a dentist to recommend a dental implant. A few of those conditions would be that someone got a crack in their tooth, or the tooth has a really large cavity and becomes decayed to the point where it cannot be saved. Or sometimes people are born without teeth. So there are many reasons why a dentist would recommend a dental implant, and one of the main reasons as well is because dental implants is the closest thing that we can get to replacing a person's natural tooth. On this last point, I want to talk about a few other types of solutions that we offer in our practice. One of the solutions would be what's called a removable partial denture. A partial denture is an option where it can replace one or multiple teeth that are missing. The downside to the partial denture is that it has to hook onto your natural teeth, and sometimes that can put a little bit of stress on those natural teeth. As well as not permanently in your mouth, you have to take in and out, and it's not something that you can sleep with. Also, when eating with a partial denture, food can get caught underneath of it. And so although it is an option for replacing a missing tooth, we can oftentimes find that there's other options that may suit someone a little bit better. An additional option would be something that is called a bridge. Now, it's not the normal bridge that you're thinking about that goes over an ocean, but a bridge is a solution for a missing tooth, and it is used by anchoring both tooth on either side of the missing gap, the missing space. And what a dentist does is just like what you would do for a crown, is we remove a little bit of the tooth structure on both teeth on either side of the missing tooth, and now we have to cement this bridge. Again, it's a phenomenal option, and a bridge can look very natural, especially the way that we do it in our office. The downside though of a bridge is because it is spanning a gap. There's things that can get caught underneath of it, and on average, a bridge only lasts about 10 years because it's very difficult to clean, and so most often, the teeth that are anchoring the bridge end up with some tooth decay underneath of them. And that's why I say that a dental implant is the best option for replacing a missing tooth in most situations. And the reason for that is because a dental implant is just one single isolated tooth, or multiple if you're missing more than one, but you're able to floss and clean and treat that implant as if it were a normal tooth. And we also can achieve some of the highest levels of aesthetics and natural cosmetic looks with an implant. Plus, when you look at the life of an implant, implants are often looked at, if they're properly cared for, that they could last a person's lifetime, which is an amazing thing to be able to offer for somebody. And so that's why we believe that when it works out, that an implant is the best solution for a missing tooth, because it will give you the most natural, most comfortable feel that what you once had before. So now I just mentioned that a dental implant is the best solution when it works out. So a lot of times we get asked, well, when does it not work out? So the times the implant does not work out is most often depends on the person's health in their mouth and also the bone that is available. Because remember, an implant is a screw that goes into the person's bone. And so where there is absence of bone, well, there may not be enough space for us to place an implant. Now, I just mentioned an implant is the best solution when it works out. So a question we often get is, well, when does it not work out? And the most common reasons that an implant may not work out often has to do with the hygiene, how clean the person's mouth is, and also, is there enough bone to place the implant? Because remember, I said that implant is a screw that goes into a person's bone, so we have to have a good amount of bone. And although a dental implant cannot get a cavity like your natural tooth, it is inside your natural bone with your natural gums around it. And so if someone has a condition like gum disease, that can also impact the long-term life of an implant. So those are things that we would address to make sure that they are in a good state in order to place an implant. So good news is, those are all things that we address in our office. Now, these are a lot of what-if scenarios. The best thing you can do is come in for an evaluation, and we can assess what implant or what procedure would be best for you. That way you have the best outcome and you get a lifetime of a gorgeous smile. So now I'm going to take up some additional commonly asked questions regarding dental implants. And one of the most commonly asked questions, again, is how long does it take for a dental implant to heal, or how long does it take for me to be able to use my implant? So in most situations, when we have adequate amount of bone, when we place the dental implant, it takes about 3 months of recovery time. And what happens in that recovery time is that when that implant is placed in your bone, your natural bone starts to grow into the implant. The implant has little grooves in it like screws, and even microscopic little holes that allow the bone to fully grow in and what is called integrate. And after a few months, when the implant is fully integrated into your jawbone, now we can safely attach a tooth on it that you can put to good use. And what's awesome about when we get to this final stage is so many patients, they come to us and they have not been able to eat the foods they want. They have not been able to smile confidently. All these things that we don't realize impact our quality of life. And so what is amazing by being able to do this type of innovative procedure is we're being able to rewrite time and restore someone back to their former glories, and also give them a confidence and give them the quality of life that they deserve. Another question I get asked is, how long do dental implants last? Well, given the proper maintenance and proper care, a dental implant has the potential to last a person's lifetime, which is amazing. And so it is very important that once you get that procedure, you're not done yet. Just like when you buy your car, you have to get the oil changed, rotate the tires, clean the car, change the gas out. Just like with your dental implant, it's very important that you maintain your normal hygiene, as well as come in for every 3 to 6 month appointments, depending on what's going to be the best solution for you. I get this question: can dental implants get cavities? And guess what? The answer is no, they can't. Isn't that amazing? And so that was so awesome about dental implants. And so people who have a tendency to get tooth decay, well, there's no better solution than getting an implant. And so another question we often get asked is, do insurance companies give reimbursement for dental implants? And the good news is they do. Dental implants have been an innovative procedure that have been around for many decades. So most insurance plans do incorporate some type of reimbursement or contribution towards the dental implant that you will receive. Now, let's just say that your insurance does not cover dental implants. Don't fret, no worry. We are here to help you. And so we want to find a way to help make this happen. And we have many, many options to help still facilitate this type of treatment for you and give you the smile and mouth that you deserve. I hope I've been able to answer some of your questions regarding dental implants. If you're interested, we would love to set up a consultation with you and discuss what option is best fit for you. You can call us at 210-734-5092. I hope I've been able to answer some of your questions. If you have additional questions or would like to schedule an appointment, please call our office at 210-734-5092 to get started. We'll look so forward to speaking with you and getting to meet you. Take care. Have a blessed day.